So research has shown that South African men are more likely to die from tuberculosis than women. According to the Wits University Health Consortium study, almost 60% of people with active TB are also living with HIV. And in South Africa, HIV is more prevalent in women than men. Now, researchers have, however, found that between 1990 and the year 2019, South African men developed TB and died at consistently higher rates than women. Well, let's get some clarity on this. I'm joined now by Dr. Mmamapudi Kubjane, a researcher at the Wits Health Consortium. A very good afternoon to you, Doctor. Thank you for your time. Men are likely to develop TB and die from it compared to women. Why is that?
Hi, Mpho. Thank you for having me. Yes, so based on our analyses, the risk factors that we looked at and what we found to be the main drivers of high incidence and mortality among men were low TB testing rates among men and low HIV testing and ART or HIV medications initiation among men. As we know, HIV is the strongest TB risk factor, so not starting treatment earlier puts you at a higher risk of developing TB. There are other risk factors that increase your susceptibility to TB that are highly prevalent in South Africa, and these that we looked at were smoking and alcohol consumption and undernutrition. And because these are much more prevalent in men, they contribute to their risk of developing TB and therefore dying from the disease.
Is the problem centered around men's access to health facilities, or is it maybe a conversation around the improvement, the much-needed improvement that's needed to encourage men to seek medical attention?
Yeah, I think the problem is that needs to be addressed is improving men's engagement in care and addressing some of the barriers that exist to accessing healthcare. For example, one major reason that could explain why men are less likely to be engaged in healthcare facilities is because we know there are much more higher rates of employment among men, and seeking care sometimes can be associated with losing time and earnings. So we need more incentives to give men to access care or bring healthcare facilities to help to places of occupations or employment in the form of mobile clinics or testing units.
Dr. Kubjane, what is also a little bit startling here is that HIV is more prevalent in women than men, yet TB is, well, men are more likely to develop TB and die from it, and there's a link between HIV and TB that really is a little bit mind-boggling.
Yeah, this is an interesting finding, but we have understood it through our modeling analysis. So yes, women have higher prevalence of HIV, it's well known and understood due to various reasons and biological reasons. But because women are likely to engage in healthcare, so for other conditions and mainly through antenatal care, so they will likely be tested at healthcare facilities for TB and for HIV. So once they start, if they are positive, they will start. If they are HIV positive, they will start antiretroviral treatment, and that would protect them from being at risk of developing TB significantly than what men are likely to benefit from treatment. So that is the main explanation for that observation. But also, given that there are risk factors that also persist and are much higher in men compared to women that drive the higher risk of TB.
And TB in itself comes in different forms. So when it comes to assessing oneself, what should men and women, be looking out for to get a sense of whether or not it's time to go visit a clinic and get some professional help?
Yeah, so I mean, the classic symptoms of TB, and hopefully we'll have more education on this. They've been reported. So it's having fever or coughing for more than two weeks, or having night sweats, and other kind of symptoms that are consistent with TB. But what we know also is that symptoms are not only the indicators of TB, because people can be asymptomatic and still have TB. So, for instance, if you know you may have been in contact with a person with TB, it's also good to have preventative measures. So usually people would be put on preventative therapy and have other tests performed. So seeking help when you experience the symptoms, and if you have had contacts that you know of, seek help to start prophylactic or some testing, further testing to confirm whether you have or not.
Yeah. In terms of just expanding a little bit on the seriousness of tuberculosis and how it attacks one's system, I mean, I learned just a few months ago about spinal tuberculosis. I mean, what are the different kinds?
Okay, so I'm not a medical doctor. I wouldn't have the best answers to that. But what we were looking at is pulmonary TB, which is mainly transmitted through it's airborne, and the other type of TB which the one you spoke about would be the spinal, is extra-pulmonary TB, so it could be in any other part of your body. And the extra-pulmonary TB is more challenging because the symptoms are not classic as pulmonary TB, and people might present much later because they wouldn't know, but yeah.
And in just rounding up our conversation, perhaps talk a little bit about the importance of socio-economic interventions when it comes to tackling this problem.
Yeah, so as we know, or for a long time, TB has been classified as a social disease, meaning we need to address other conditions that increase people's risk to TB. For instance, socio-economic conditions like the living conditions. If you are living in crowded conditions, it means the risk of transmission is much higher, and your immune status affected by your nutritional status. So undernutrition is an indicator for socio-economic status as well. So tackling undernutrition, and we've had a recent study that was conducted in India that showed that providing households with nutritional support can reduce household contacts it can reduce TB incidence in household contacts. And that's a really groundbreaking study, or just a good example of a social intervention that could be implemented in countries such as South Africa, that we could also look into. And other is breaking the barriers for accessing TB care.
Yeah.
So as I mentioned, providing nutritional support and sometimes monetary support for TB patients, because they also incur other costs while going to seek care, and additional seeking, for example, micronutrients to support the immune system, and that needs more than just the treatment itself, but more socioeconomic support.
Are our health facilities offering those options and that educational that's needed when one goes in and finds that they are indeed in need of the full medication for tuberculosis?
From my understanding, so currently TB, for a long time, TB testing at health facilities has been passive. So if you report to have symptoms, then they will test whether you, then you'll go for a symptom check and then get a screening, an actual test. But in recent years, there's been more upscaling of more innovative interventions, such as looking at specific risk groups. For instance, they would target people with a history of ever having TB. They would immediately just test them, or people who are with HIV, they would also test them. So there are currently some interventions put in place at healthcare facilities to improve the gap that exists in diagnosing TB patients much earlier. But the question is reaching the broader community, and that's why, in addition to these, we need more interventions that would reach people who are unable to reach the healthcare facility. So community-based screening efforts are also needed to complement these.
Absolutely. Thank you so much for your time and insight, Dr. Mmamapudi Kubjane, researcher at the Wits Health Consortium there.